12:02. So first up, we want to approve the minutes from November 1st. Is there a motion to approve the minutes?
Motion.
Thanks, Lori. Is there a second?
Second.
Abby beat you to it.
Okay.
All in favor?
Aye.
Great, thank you. So today's really exciting because after all the information gathering, we're going to dive in and come up with some, using the template that Abby created, which is wonderful, really get into the impact areas that we've talked about, critical areas of need, talking about defining the problem, the impact on public health, some potential solutions, and other agencies involved in addressing those topics. We started with transportation at the last meeting, so maybe we can pick up where we left off with that one.
I feel badly. Do you want me to pull this up on Google? Because I haven't yet. Want me to? Do you want it
yeah.
on the screen?
Yeah.
Good.
Well, I mean, is that the best way to do it? I guess, is that the only way to do it,
No,
Karen?
no.
Well, just in terms of getting what we want documented? Like, we have to do it all here at the meeting, right? All of our
Yep.
ideas. I feel bad having you.
Oh, I don't mind typing.
Okay.
It's going to take me a second to figure out how to go find it. Give me a second. I think Kevin might be listening. I don't want to compromise the Zoom meeting view if I do this. Just watch.
While Karen does that, I thought it's always
Think we're gonna have
dangerous
to
when
figure
I
that
start thinking.
Abby, can I borrow you for a second?
Yeah.
I thought of another category that maybe we should consider, which is food
Plug
insecurity.
in it as you and pull it up. I can type. You know what I'm saying?
I think so.
I feel like that came up at one point.
I thought it did
Yeah, I did
too, and then
too.
when I was looking at the list, it didn't.
You can
It
drag
wasn't
that
on
box
here.
out of the way.
Yes.
And I was looking at some report that talks about the 5 key social determinants of health and their contributing factors. And we cover the 5 of those things, but food insecurity was left out.
Do you have those 5?
I do. Do you want me to read them?
Sure.
Okay. Economic stability, which the contributing factors would be employment, food insecurity, housing instability, and poverty. The second one is education, the contributing factors being early childhood education and development, enrollment in higher ed, high school graduation, and language and literacy. 3 is social and community context. Contributing factors are community participation, discrimination, and social connection. The 4th is health and health care. Factors are access to health care, access to primary care, and health literacy. And the 5th is neighborhood and a built environment. Contributing factors are access to healthy foods, violence and trauma, environmental conditions, and quality of housing.
So, I mean, I think that speaks to what we've been talking about with the overlap of all of the different things.
Sure does.
How do folks feel about, with the ones we've came up with, adding the food insecurity piece as another topic area? Or maybe it'll come into play with some of the. All right, we'll put,
We could, I guess we could see if it, again, they all
yeah, there's a lot.
overlap.
We need to sort out what are factors, just factors now, or things caused by COVID. You know what I mean?
I think everything's been exacerbated by COVID. I think, like, the research that I was doing indicated everything that we've talked about, and I've got some really good data points. All of these things were in existence prior to COVID. We were not really successfully meeting any of these challenges. And then when COVID came, it just either exacerbated it or widened the lens, pulled the covers back, and made it a real reality for not just the people that were experiencing it before, but then added people to those challenges.
But I think you bring up a good point, Lori, though, in that the way I see it is if we can come up with the solutions and the problems and all of the description stuff, then as we're prioritizing what we might want to make for recommendations, we should have that COVID lens of what has been, since it's a COVID response task force.
I just know that there's been, COVID money for, food stamps, things like that, that is, changed it up for people.
Yeah.
My son gets food stamps, and he's got a surplus because of the COVID
Yeah.
money coming in.
Right.
So are we ready to go back to transportation?
Yep.
Not at this moment.
No?
No.
I'm getting there.
Sorry.
What I can do while I'm trying to multitask is, last night at the council meeting, Larry McCullough and Mark LaFay presented where things stand with the Greater Portsmouth Recovery Ready Community Coalition. It's a mouthful, but the upshot of it is that the.
Because I can't see. Oh, okay.
Oh, no, I think I can figure this out. The Councilor Bagley wanted to make sure that this presentation and the content and the activities of the group are something that the task force is taking into consideration, with the thought that, are there ways to collaborate or include what they're already doing? So we can consider that for an upcoming meeting. We could have Larry and/or Mark come in, but this was timely and was presented last night. The ask from these folks is for some funding from the city of Peabody. So the council is currently considering their request at $60,000 per year for 2 years. So you'll see this.
I'm sorry, can you say that again? The request was for 60,000 for what?
For support for the program for 2 years. And so the question to this group was, does any of this fit in with what we're considering? The city council is weighing whether to support this request standalone, and if so, what kind of funding to use. So Andrew Bagley asked that this be shared with the group. I said, great timing, what we're meeting today. So we can figure out as a group what to do with that.
So this is from the Pine Tree Institute and Foundation for Seacoast Health?
Correct, in the sense that Foundation for Seacoast Health is already a funder. Slide 5 of 5 explains that the foundation has pledged $30,000 for 1 year, with a second year contingent on participation from the city. And the final piece of what they're looking for is being sought by the New Hampshire Opioid Abatement Program.
Okay, thank you.
So I said I'd be the messenger and bring it to the group, and we can determine as a group how to incorporate both efforts. So here's my question, Abby. This is showing in presentation mode. Am I able to type if you guys want me to type something?
I think so. If you want to go to click on like that transportation and go over. Because you have editing rights, so you should be able to, Karen.
Oh, goodness. Okay. Okay.
So the request that you just mentioned, Karen, is that a request for city COVID funds?
Or is not specific to how the city could participate.
Okay.
And so less for this group to figure out where the money comes from, and more to figure out programmatically.
Okay.
If it makes sense to coordinate with what they've already got going on with what we may be thinking about.
So maybe something to talk about when we get to substance misuse slides too.
Exactly.
As a program
And
or.
I'm sure Larry and/or Mark would either join us for a meeting or Zoom in at some point and participate.
All right, sounds good. All right, so we left off, we had begun talking about some potential solutions to
Do you want to move so you can see?
transportation.
Yeah, that would be good.
Yes. So I think if we go to the next slide, Karen, I think we had started talking about potential solutions. All right, CDL vehicle.
Can anyone read that for the group? Because I can't.
I can't. I did not bring my glasses.
Scholarships, subsidies for CDL drivers, driver's ed scholarships as well. City purchases a fleet of non-CDL vans. And then the question would be how to operationalize. So those were the ideas we had so far.
Does anyone have other ideas for potential solutions?
Well, I think one we kind of touched on was using vans that are already out there, possibly, I didn't know if it was recreation, or my other questions were Robert Lister or like Portsmouth Housing Authority. So using some of the things we already have in a different way.
Amber, you had an idea, right, with some of the existing employees or retired?
Yeah, I had mentioned last week just an idea that I had thought about, thinking about what we have for police, the police department or the fire department, and how, whether it's vehicles or manpower, to somehow incorporate that into the transportation solution. And then I was thinking to another level, just if there were retired police or fire or people that were working part-time, or maybe you could get, that extra overtime or something like that, because I think it'd be great for the kids to have, someone like that driving them.
I think no matter if it's the city managing this or a private entity, there may be a liability issue or a coverage issue with certain drivers, and you'd want to make sure all the drivers are able to be supported.
Right.
So from the school department, we weren't allowed to put kids in our car anymore. That stopped years back. So we had to have city-covered buses when we went on field trips, or walk.
Right.
But even to take kids home, if they stayed after school with me, I'd have to have their parents come pick them up. Even though I had the right coverage, the city's insurance said that was a no-no.
Right.
And that was 2018. So I'm pretty sure that hasn't changed.
Right.
I don't know if I'm capturing that right. How would you say that? I was trying to figure out what you were saying.
Retired public safety professionals or opportunities for extra,
Like to fill in the gaps
Right.
of the workforce?
yeah,
kind of,
workforce
or-
gaps.
Because it could be for driving other than school, too. It could be for medical appointments or other things, too,
Right.
if, depending how.
I'm just not sure how to capture that. So if you tell me how to say it, I will type it.
Okay.
So I don't really need to type this too then, Karen, right?
I would say no.
I'll just refer to that document. Okay.
Retired public safety professionals.
You want to scribble, and if
Use-
anyone else has anything else, we can.
Well, I had
peruse
talked
them.
about the retirees or people that are, want to do some part-time work for money. So it would be more like a car, not a bus. But that could get people to medical appointments. And Medicaid would pay for that, for the people that are on it.
I read in Exeter that they offered some sort of discounted taxi vouchers. I don't
Access to taxis?
know.
I don't know either.
Were they drivers? For driving, you mean?
No, so that people that needed transportation
Okay.
received vouchers for a discounted service.
Sit here, because otherwise you.
Which would, I would think, help the taxi industry
Right.
and the people that
It's like an
need it.
Uber gift card, like if you could
Yeah.
give somebody a prepaid Uber gift card or something for a certain amount of rides, or,
Do we know the capacity of taxis in the Portsmouth area?
I don't even know if there
I
are
know there's
taxis.
one taxi medallion issued
it.
in the city.
Wow.
We just looked into that.
Wow.
Because
Okay.
I know in another part in Stratford County, for some of the work, we were able to do that. And it worked if you have a good taxi service that's available and able to do that. But
It has to be reliable.
it has to be reliable. And I think that's still one of the things we're seeing in terms of, we have funding to help pay for Ubers and things for clients, and we're still finding that we can't get them, or they're being dropped, like they're supposed to be coming to pick up, and then they get notification that they can't come. So,
I was also thinking, just especially after listening to the welfare department, just thinking about that population that needs work or that needs training or jobs, and could we somehow have some support around people getting trained to become a driver? I mean, you'd have to pass certain protocol anyways to be accepted, but could we sponsor the education for those people that are looking to work?
Well, I was just thinking even like a marketing campaign, like supporting some kind of marketing campaign too. Because when I went on the commercial driving school, the one that they have, even to pay to take all of that, I think it was like $9,000 or something. So it is like, and it's one school, and it's that much money up front to then even get trained.
That's
and
for
then we have the
CDL?
shortage. Yeah, for the CDL. I was like,
Local?
Concord. So it's the one place in Concord, I guess, is the one in the whole state.
So $9,000 for one
There were like
training.
different trainings, but for like a CDL, it said 9,000 something. Yeah, there's like a 4,000, but that didn't get you all the,
Right, so that's part of the issue too, then.
yeah.
What we might want to do is reach out to, I don't know if we do this or after the fact, reach out to Great Bay and
Yeah,
see
that's-
if they can help put a program together,
Yep,
because that would be a whole lot cheaper.
yep. I was also thinking about reaching out to like C&J, just like like a private, just to see if they obviously
Yeah.
know who do they hire, where do they hire, how do they get people, just to that might be something that's worth
But
just
I know
picking their
they're having
brains.
their own issues with staffing.
Yeah, totally. But if they had
that's a
any
good-
ideas.
That's a good
Or
idea.
do they have drivers that would want to work, kind of feeling more like on the public health, 2 days a week, driving people to appointments? Would that appeal to some people? I don't know.
Well, and when I was thinking about agencies involved, I was thinking about figuring out what we know about the agencies that have their own transportation, as well as I know even agencies like mine, are looking at, is that something we want to take on ourselves? And I don't know if that's a possible solution too, in terms of even some of the nonprofits sharing of
Oh, yeah.
transportation in order to help with the clients that
Yep.
need to get to all the places.
I like that idea.
I know, that is a good idea.
It requires more thought, but.
All right, what did I not write?
So nonprofits working together as a team for
To
transportation.
actually hire their own staffing for transportation.
To share
Hold on.
transportation.
Say that again, work among, yep.
To share.
Which would require purchasing vehicle and
And why
Right.
not check with Coast also if you're going to talk to C&J?
Yeah.
Yeah.
Well, right, and maybe we put that down in the agencies involved
Yes.
too.
Didn't we have that in Stratford County, that
Oh, yeah, okay.
coalition that went on forever? And
Say that again, Janet?
Stratford County, we had this group that was going to try and do that years ago.
that was
Because-
years ago.
Yeah, because community partners had vans, homemakers had vans, and that just
Didn't go anywhere.
didn't go anywhere. Yeah, I don't remember why.
It seems like
Money problem.
it seems like the inventory of vehicles isn't necessarily the issue. It's the drivers,
It's the workforce.
right? So I don't know that purchasing vehicles makes a dent in the issue at hand when it's actually people, able-bodied people. And if we're thinking about bridging, unfortunately, people that are out of the workforce, the unemployment rate is so low. The age of residence is high. The cost of living is high, so the people that need work, I don't know that they're going to be drawn to this sort of opportunity.
Well, and one of the things, when we were looking into it, it was really looking at the liability piece of it needing to be the agency's vehicle and who would be insured and able to provide, so it's actually more cost-effective to do it that way than it is to have staff that are transporting people with their own.
Own vehicles.
With their own vehicles. And that would be my question about share, if there were trying to coordinate who could do that in terms of the liability piece, but I just don't know enough about it.
There's, to Abby's point earlier about marketing, I think that's a good angle. If we can, one, figure out who might be available, and of course, we can look at an older population who can still work, or, wants to work a few hours a day or whatever, but sell it from the perspective that you're helping to create community, solve a problem, help nonprofits, any of those kinds of things. That it's not just a job; it's a job that's you're really having an impact on the Seacoast community in terms of getting people from point A to point B, which is so critical to getting people's lives, getting people to move on with their lives and create impact and value for our communities. I mean, there has to be some sort of social, humanistic angle to it, I think.
So here's where I feel like I get confused and off track with our goal. Who's creating the marketing? Like, what is the ultimate goal there? Like, we are making recommendations to the council about where we think funds would be best used. So I don't think it's the intention that this group would be identifying marketing materials. And since there's already organizations that are fully formed, just struggling right now to deliver transportation or provide transportation to all of the people in the community that need it, wouldn't it make more sense to give an opportunity to fund existing organizations, like maybe create something that's a collaborative effort, support a collaborative effort for nonprofits, but like if we already have Coast and Wildcat Transit and Task and a fleet of vehicles within the city, to me it's more logical to lift them up so that they can expand the routes that they had pre-COVID and maybe add opportunities for support to nonprofits.
Yeah, I mean, I think this is where the issues overlap, because I think when we talk about workforce shortage, that's really what you're talking about, is helping them with the workforce to have the capacity to do more than they're able to do.
I just am not sure that, like, us trying to think of new, I have a feeling that every organization that provides transportation in Portsmouth and surrounding communities has gone through all of these conversations over the past 2 years. So here we are, the ones with this bucket of money to try to help inform. I don't think we want to recreate the wheel. I think we want to say, if funding is going to help you, here is some.
Well, and again, thinking about the charge of the committee is, small dollar solutions that have a greater impact. And so maybe we have to just keep reminding ourselves of that in terms of these topics and what could be done, because we're not going to solve.
Well, and that we're just generating ideas.
Right.
Ultimately, it's not up to us. We give the list over, and it'll be debated, things will be crossed off, and hopefully, I think including the agencies is a great idea, because a lot of it doesn't need to be recreated. It can be like, oh, we want to do marketing. Let's talk to all the things, these people are already doing it, and see what they think. I would hope that's what would happen.
Right.
Because we aren't the experts in that. But just generating these lists of ideas, I think,
Does
and not
anyone
going too
know
deep.
how much the state, how much Governor Sununu received of the, the COVID-19 relief funds, and how that money was distributed?
That's a lot of
It's
money.
huge
That's a lot of money.
A lot of different
I wonder
places.
if any of that money was used for with this very topic. It'd be
Well, I mean,
interesting to find out.
I think we've identified that this is still a major need here.
Oh, it's
So-
not a major need, but I wonder if, like, where be interesting to find out how that money
Because a lot of
was.
that money hasn't been spent yet. Like, the
Right.
housing money is just going out, so there could be transportation money that we don't know about that hasn't
Yes,
gone out
right.
yet.
Yeah,
Right, but-
yeah. Be interested to inquire about that, right.
One of the things
Part
I,
of our role, though, I don't
Yeah.
think.
Yeah.
We have a very small role here,
Yeah.
and it's just focused.
But
Just
just
to
I'm thinking
spend
of what
this
you'd
money.
learned from what they did in terms of.
Right,
you know,
the city may have
Yeah, might be.
all that information.
I think, there's, one of the things that ties all this together is the issue of workforce. And the machines, the cars, the vans, that can always come. That's not the major issue, as you guys said. It's the workforce. So how do we, long-term, and again, this is beyond our role, but as we make recommendations to the city council, how do we make sure that our local community college, which could have a significant impact on all of this, in terms of the direction and strategy about programming, really understands the local need, in this case, transportation, that we need to figure out ways to attract more workforce to that area and incentivize it in a way that allows for lower cost programming. And a local programming on the Seacoast that can help train CDL, people for CDL licenses.
We need workforce housing, we need workforce housing.
Right.
That would attract them to Portsmouth, because right now, it
Right.
isn't.
Right. So that those are the two things, housing and workforce.
well, and
Because I
Lori,
think we can talk about all these things.
Well, we're getting to workforce, but those are some slides later.
Right, yeah.
So would
And
a,
housing.
So should we try and tie this one up?
yeah, should a potential solution be some type of support for workforce housing for drivers? For new drivers, or?
Just, I think workforce is a topic in here.
Right.
It is.
We just
So we've
need
just
it.
tackled the first one. We have to go, we have mental health, workforce shortage, childcare, housing, and substance
Misuse and
misuse.
possibly food insecurity.
so as we close out on the transportation one, the one thing I was thinking though, Laura, you brought up about taxi vouchers, I do think it would be worthwhile to find out about the status of if the taxi company that may exist here in Portsmouth, because to me, that could be an opportunity if there was assistance again on workforce and looking at what their capacity is to have something like vouchers.
Is that all that Portsmouth have, is one
Yes.
taxi company?
Yes.
So, from what Will was saying, should we add to the list of potential solutions to work with Great Bay Community College to increase training opportunities?
Maybe list Great Bay as an agency involved.
I did.
That might
I
be
put
what
them
you're
there,
doing.
yep. How do I make this bigger?
Totally forgot my glasses.
You can't.
You know,
Oh, you can drag the
moved
bar
from
down.
Uber to Lyft, and we pay, they invoice us, so that's how we get our patients around.
And you're able to access
Lyft
them?
is successful.
Because we do both, but
Yeah, we didn't have any luck with Uber, but we seem to be having luck with
You can make it.
Lyft.
So there's a few
Presentation
listed.
board.
I don't know how many of them actually have medallions, but there's Annie's, Portsmouth Taxi, Rockingham Taxi, Binks Taxi. I can also. It was organized with the Exeter Housing Authority and the Exeter Parks and Rec. I could reach out and see how it's going. Sure. To do? Okay.
So, when you use Lyft for your patients, did they get a voucher, or how does that work?
No, they just invoice us,
Okay.
and then we pay them.
So Lyft directly works with you?
Yep.
Okay.
All right. So, sorry, we're trying to make it more legible for everybody.
thank you. Okay,
You wanna move?
anything else on transportation before we move to mental health?
We can always come back.
Yeah. Oh, I don't think we'll have a hard time defining the problem.
Yeah, I know, right?
So, reminder to everyone, we're looking at problem, impact on public health, potential solutions, and agencies involved.
So,
Access.
access is the big
Right.
problem, lack of therapists,
How do
waiting
you
lists.
unbold, Abby?
Control B?
Control who?
Control B?
You know, like, I can't find her toolbar. It's just,
Yeah.
does anybody? Because then I could unbold, change
Thanks,
font.
Access, lack of therapists, did I hear?
Therapists and psychiatrists, particularly
Yes.
child.
Professionals, you know.
For youth and adults.
Yeah, mental health providers.
And the children is like, you just cannot get kids in.
Providers.
No.
And also insurance coverage for
Health providers.
cost.
Transportation to such mental health provider if telehealth is not an option. Oh, look at that, we're back to transportation.
Well, telehealth is a really good option,
Yeah.
yeah.
Just explosion of the number of people that.
Right,
Need it.
mental health.
You know, during COVID and post-COVID.
Yeah.
The ERs are backed up, people are waiting for a week to get a bed in the hospital, in the state hospital.
And also individuals lost services during COVID and they haven't been able to get them back.
Right.
Right.
How would I phrase that?
You talked about the kids that, like the disabled children and that were getting.
Yeah, and older
Well,
adults
so
too.
ongoing treatments were stopped
Discontinued.
discontinued
Yeah.
during COVID and not able to be
Resumed.
resumed.
Because now there aren't enough providers.
Childcare
or-
costs? Childcare costs?
That's under
No?
child
We'll
care.
go down
Childcare.
to childcare, yeah.
Pardon me?
We have a
We have a
section under
separate
child care.
section.
And last week, the Seacoast Public Health, family stress is high, social detriments of health have risen. Inflation are all
Oh, yeah.
causing
Mental health.
mental health.
Say that again.
Family stress levels are higher now because of COVID. Social detriments of health have risen due to COVID. Inflation has risen and caused big concerns for families who are trying to make ends meet.
Which leads into the impact on the
Right.
public
Mental
health.
health, right.
Yeah.
And housing.
Increased depression,
Misuse
suicide.
of suicide.
Misuse.
Drugs and alcohol.
Oh my goodness, what happened?
So I think impact, yeah, we're on to an impact,
Yeah.
right? Yeah.
Yeah.
Impact on, I'm sorry, Kathy, what'd you say?
Suicides.
The impact on the mental health, public health would be depression, increased depression, misuse of drugs, suicidality.
Hold on,
Less productive workforce, which.
hold on,
whatever we
depression,
have.
what was the second one before suicidality?
Misuse of drugs,
Gun violence.
Oh, so-
That was the-
Less productive workforce.
Family stress too,
Yes.
parenting and.
Does anybody know did more people get split up?
Can you
Families
use your
split up?
microphone?
Oh, sorry. Did more families split up during COVID? I don't know. Just to answer the question, I was thinking.
Anecdotally, it feels like. Anecdotally, yes.
Same anecdotally.
Then that means that poverty, increased poverty, you have a single head of households.
Which then increases if there's children in the home,
Right.
various issues that they might have
Yep.
moving forward.
And Seacoast Public Health Network said the top concerns of the youth are mental health and safe alternative activities.
That might be a solution. Safe alternative activities.
Yeah, we might want to switch to solutions.
So I have to get through BH to be a certified licensed clinical therapist, it's 8 years, which is okay, but then you have 2 years of supervised supervision. And can they shrink that? And can we bill for interns? Because if we could bill for interns, you double your workforce. And so, it would really help
How do I
That's a
phrase that?
licensure thing.
Ability to bill for interns?
Yep.
Is that very specific, or is that more?
For licensed clinical social work interns, or marriage, what's the other one? What's the other group? Marriage counselor?
Marriage family therapist.
So we would call those alternative.
That would be the
Board of- that would be the board of-
licensure
State
authority.
board. State.
Yeah.
Yeah, for
And they
BH.
wouldn't like to do that because that sort of lowers the standards for credentialing.
Well, except they're still going to be supervised, but we could independently credential them to bill. Because right now, you have somebody supervising them and basically
So
reviewing
how
all-
would what would the recommendation be to the council?
Well,
Use money to get that to happen?
the recommendation would be to be able to bill for, under them.
I can't hear a word she's saying.
To
Can you grab
bill,
the mic?
sorry, to be able to bill for interns. So they still have a licensed clinical social worker working with them, but maybe not reviewing every record. They have to
How
read-
does
how does
this
the
part
city-
of money?
Oh, how does it's really not part of money. It would be changing the standards.
So how does it relate back to the recommendation?
Right, probably not. I mean, it gives, it
I
brings,
wanna
well,
make
no,
this
no,
happen.
no, but it brings in more workforce.
Right.
That's where it comes.
But I don't know, so.
But it's a different strategy.
Do we
Yeah.
provide money to Seacoast Mental Health for advocacy to get people to the State House to lobby for a change? Or, like, I don't know. The money has
Yeah.
to go on
Yeah.
a path.
Yeah, true.
What if the city was able, some of this money could support mental health professionals or mental health agencies in providing group therapy rather than individual therapies? So if they had some type of, maybe some of the money could go to like a group setting, like seeing clients and patients in, like for kids, I'm thinking. Like if there's, some type of, I was just thinking that would be maybe a solution to.
That's
Amber-
billable. That's billable. Group therapy is billable for each individual child.
But what about for like, guidance counselors, right? Like, are they held to the same standards as like a clinical social
No,
worker?
I think they only have a bachelor's.
Yeah.
I'm not sure.
Like, that would at least make a dent in some of the kid issues if the kids were in school.
I think one of the
Would the money
things
be
that,
used for, like, encouraging college students to, like, learn more about counseling? Being counselors or childhood care workers,
that's a long
educators?
term, that's
I know it's
way out.
long-term, but I spoke with many teachers, parents, and residents about these issues, and that was one of the things listed, that they definitely need more of these childhood care workers and educators that are focusing on these issues. It could just be some additional training with teachers who are already doing it, but having things be updated, and also on a community level. People mentioned how they would like to have a host of these topics being presented in our community. We used to have public forums on these issues.
Well, and I think one of the things I know that we see is that we have some of those systems in place where there's that peer support, and what we're really trying to get at is the increased mental health needs that go beyond what those folks are able to provide. So really looking at getting the increase in the clinical availability for folks.
I'm just wondering also if there is an opportunity, talking about short-term, if there is more online mental health counseling, if there's a way to support that. Meaning, are there psychiatrists or psychologists that haven't built that system up, that may need, the equipment, the technology?
I think most everybody has.
Everybody has built it out now?
Yeah, and it's inexpensive to get that set up.
Like Zoom?
One of the questions I had was, and I don't know the answer, is what the capability is or the capacity of EAP programs for local businesses and nonprofits in terms of the employee assistance programs where folks can access short-term mental health and get referrals if needed to. I know we pay into Exeter Health Resources in order to provide
we
that
do
to
too.
our staff, and I don't know what else is available for smaller organizations to address the mental health needs of their staff, which gets into the workforce piece.
How
And
do you want me to identify that?
EAP programs that have excess capacity? Or give them money to get more capacity?
Aren't EAP programs part of insurance? Your insurance relationship? It's a separate?
Separate, we pay for it.
Some have their own, like larger companies have their own
EAP
employee assistance program, and then smaller ones buy into things
It's a
like.
similar benefit. Sometimes it accompanies the insurance, sometimes it doesn't.
We could, to get people into the field, give them scholarships. I mean,
That's such a long, we need something that's going to be a short, get the help now kind of thing.
One other thing I was thinking of is having agencies coming in, so providing agencies that already exist, like we're talking about Seacoast Mental Health, Haven I know comes to the schools, but could there be kind of money that they are funded to run programs at the Portsmouth the Housing Authority? I know we talked about, that they need some more programs, or at the schools or different places where they're coming in and kind of targeting a lot of people with one program. So whether it's a program on like self-regulation or a program on, healthy strategies for mental health or something like that, where they get money, they're already doing the work, but funding to provide their programming, but not on like the one-on-one therapy level, but maybe targeting more people at once. And using the agencies that we have, so many great agencies already doing programs, but.
Yeah.
Like
Well, and-
Soul Models is one that does
Oh, yeah.
schools,
Yep.
and they go in and
Yes,
work with girls,
exactly.
and, looking at what, the nonprofits that are
Soul
already
Models.
supporting.
Oh, yeah. Yep.
Which I think speaks to when you were saying how the Seacoast Public Health Network talked about safe alternatives for kids and
Yes.
the program that you have at your school.
Yep, and I think that's another potential solution is creating more safe, alternatives to after school. So whether that would be supporting, rec programs, like even giving scholarships to rec programs so that kids have those opportunities after school, or different, PMAC or Planet Rangers or stuff that already exists, but just getting people to access it.
And then get them back home again.
Right. Well, then there's the transportation. But.
Well, and I think
Obviously,
that
it's
was
come
an
around to
example early on when this task force got formed about, would something like camp scholarships or something like that help the mental health needs for
Right.
kids?
Yeah.
I was at a meeting last night at school about school safety and like the ALICE programming and stuff that's rolling out. But the elementary school doesn't have a school resource officer because they lost funding for that. Would that idea fall into mental health, do you think?
Well, I even put just like a position for coordinating like mental health services with community activities for kids. I don't know, just because there is this disconnect between, or maybe it's a social worker, I don't know, but there is a disconnect between the people who need the most and then accessing what they need, and there's no bridge, really.
The other
School
thing
ends and they
is-
go home.
School, and the thing is, schools already have the whole social emotional learning curriculums and things like that. They're sort of working on that.
Yeah.
Whereas the parents,
Yeah.
that's where a lot of the problems are. So I think, we don't want to
Yep.
go too nuts on the kids when a lot of the source issue is the parents and home instability and stress and that kind of thing.
There have been programs in schools where parents, when I think of the different places I've worked in, where parents would be invited for special programs like this after school. Their children were taken care of while the parents came in, and they had these workshops talking about these major issues. That's a long time ago. These
Yeah, I was gonna say,
issues have
unfortunately, it
been
doesn't happen anymore, but.
Well, and I think one of the challenges that I see that we have is knowing that there's organizations and people doing some of these programmings that we would want to increase. How do we make a recommendation around that when it doesn't make sense to create something new?
Right.
But how does that get coordinated and how does that end up happening?
Well, one thing we could do is like a grant application where, we've decided our two priorities are, let's say, just for instance, child mental health and transportation. So we're offering grants to all the organizations in the area who can apply and show us that they're going to do something. Right?
Yeah. Well, and that's almost like phase 2, maybe. I don't know, after the city council decides what they want to do. It's like
Suggest that
how.
we put that in our recommendation, that they consider a grant application process for all of these
Yeah.
topics.
Right.
We do parenting programs and grandparenting programs that are raising their grandkids, and they're very successful. There's 3 of them that we do that are research-based. Nobody pays for them. They're free.
Right.
There's an organization called Step Up Parents that focuses specifically on
I've heard
that
that.
second generation
Yeah.
that's raising their
That's the one that we're
grandchildren.
trained in.
Yeah.
Yeah.
It's a really, really wonderful group of people. But I think, I'm so glad that you said this piece about the grants. I was hoping that the conversation would go there. We are going to continue to have this discussion, whether the topic's transportation, childcare, mental health, substance misuse, whatever it is. We're going to brainstorm all of these ideas, and then we're going to say, all right, we don't need to recreate the wheel. There's already these agencies that are dedicated to doing this work. And then we're going to say, right, so we're going to tell the council that here's all the groups of people and organizations that are doing this work, and you guys just open up a grant application, and we can help review them and then give feedback back to you about what organizations look like they have solid plans. And bada bing, bada boom, we're done.
Yeah, because the few grant applications that were sent in at the beginning of all this were just, sort of word of mouth that didn't really go out in a unified way. So we could make sure that everybody who serves people in the Portsmouth area.
That's where
gets
marketing
this.
dollars will help.
Yeah.
To get the word out to
Right.
all of the agencies.
That it's an option to do this, yeah.
Yeah, that this opportunity would even exist. And that's where community forums, maybe, Nancy, would
Yes,
play
yes,
into
yes.
the picture
That was
where we
mentioned by
can
a number of
have.
people, community public forums on these issues.
And it wouldn't necessarily be a community forum for people, like members of the community that want to come ask questions, but a forum for the organizations to attend a meeting to learn more about what the process is. And certainly it's available for other people to join in and listen.
Open to the public. Yeah.
But maybe an opportunity for other people that want to volunteer to help lift these programs off the ground. They could at least get educated about what might be happening.
Well, and maybe this framework of the problem, the impact on public health, and the potential solutions still gets spelled out, and then anyone submitting a grant would be addressing those three things
Absolutely.
specifically.
The thing is,
This
there's
is
probably
a
not
great
a
framework.
nonprofit organization that's doing the transportation piece.
Yeah.
I mean, they're all having their own little transportation things, but who's going to solve the transportation? So we may have to split it up and say there's going to be a grant for nonprofits to do good work, and then there's going to be another chunk of money that's going to go to transportation that we're going to, I don't know, taxi vouchers or hire new bus drivers or whatever it is. But I don't think there's a organization that's going to solve that problem unless we give it to Coast.
Because I don't actually think the problem is, the problem goes back to workforce. And the reason that we don't have a workforce is because we don't have housing in this area for them to live in to do these jobs.
So would it make
moving
sense
on.
to continue and try to get
Yes,
these filled in, and then
Are
we
we
can,
supposed to finish all these today?
I know we do need
as
to
many
figure
as
out what-
possible.
Yeah.
But now we know what
Our meeting.
maybe our end goal is, so now we're just filling it in. So when we're looking at people applying for grants, they're.
Well, I took the liberty of making a summary, a recommendation
saw
summary
that.
slide at the end, and I heard fund grant programs
There
that
you go.
touch upon these. I think Lori had another one, but I missed it. If we were summarizing. We have a grant program. that
Oh,
hits-
public forum, you said public.
public
Public forum to find out how to fill out the grant and find out more about it. And marketing, to let people know that there are these COVID grants, or whatever we're calling them.
So next on the list, we have workforce.
I wonder what the problem is.
Oh, and
Not
before we
enough
go on to the next topic, I was going to say, I brought along some of my notes from all these different community groups that did forum. Some of you might remember hearing the Portsmouth Citizens Alliance, where they had they had a series of gatherings, and it would be in a number of places. It would be in the library, it would be in, I'm trying to think of which school, in their auditorium, and there would be all these people who showed up, and they worked in little groups, and they came together discussing these programs. There might be 5, 6, 7 people in one group, and there might be 8 groups. And then they summarized and they'd present, and they participated in coming up with, whatever the results are, what they were going to do. And the topics were traffic, transportation, neighborhoods, economic concerns.
If I could make a suggestion, that could be something the council does with this information to kind of
Yes.
gut check it with the public.
We could ask them to do that again or something.
Sure, I think our work is to get them
Yeah.
something to go get reaction
These are
from.
notes from 2015.
So I think, in addition to lack of housing to support, there are people not going into the medical field anymore. And so we don't have dental assistants, we don't have nurses, and that's nationwide. So that's a long-term problem. I think that certainly we need to start working with the schools immediately, high schools, to see, because we could train for DAs, dental assistants, and medical assistants.
What about the career technical education space at Portsmouth High School? Maybe there could be a suggestion to
Yep.
That could be a
reach out to
solution.
them.
Yep, and just follow.
Where are we putting that?
people
That's a
that are
solution,
doing
reaching
these
out to,
things.
we're
'Cause
jumping
those,
ahead.
those lower,
So,
those things that were
on
lower
childcare?
paid
Which one?
jobs, they're high-
Workforce.
high paid
Workforce.
jobs.
Reaching out to Portsmouth High School,
Okay.
the CTE program.
Great.
But the
So
dental
is
schools,
that what we're doing? We're going to solutions now?
Well, we kind of just did, but
That's fine.
the dental program up in Maine, they're 40% full capacity. Dentists just don't exist.
yeah.
Part of that is the requirements of the dental board here versus our neighboring communities. They have to actually do live work on people to get their boards, and then the neighboring communities do not have to do live people.
Yeah, and I mean, I think it's a huge challenge in terms of, we see it in the nonprofit sector too, where we're not attracting, if we are attracting the younger workforce, they're not staying like others did. And so looking at kind of sustainability and opportunities for growth and.
The way we think about nonprofits is all wrong.
Exactly. But that's not for this
A whole
task
nother
force.
conversation.
We have about 5 or 6 minutes left. Do you guys
Yeah,
want
right.
to tackle any other slides? We still have childcare we haven't talked about, and housing and substance misuse.
Yes. So, I mean, would it make sense to just, if there are some potential solutions, to just throw out under any of those topics to get them captured and then?
Yeah, did anyone come with notes that we could?
Well, I had,
Well, I think
for the workforce shortage, I mean, maybe Great Bay would look at investing with money, a dental assistant program.
I don't know if that's a low-cost, high-impact.
Yeah, that's a significant investment.
Okay.
But certainly can be put on the
That's
table
okay,
for
you
now.
know better than I do
Yeah,
on
no.
that.
I had just for potential, like, I know we had talked about this before, but like the CDL licensed scholarships
Yep.
or driver's ed scholarships, just to increase workforce as a solution. Recruiting high school students for local jobs, because I know the teenage population of workforce is also way down. But maybe, I know Flatbread Pizza did it recently. They went and brought pizza to the high school and said, will anyone come work for us? Because my daughter
Did it
told me
work?
about it.
Yeah.
She did. She went and applied. But I think just those, how could we do some of those kind of incentives?
And job listings,
CT.
Summersworth High School has a poster right by the front office that
Yep.
lists jobs, you can post there.
Yeah, I was saying that with a public library, maybe like a job
Yeah.
board or something. I don't know.
Virtual, too. I
Yeah.
mean, they're all virtual
Right.
now.
Well, and
And then the retirees, because I'm sort of one. Like, so many of my friends are retiring and they're just partying. They're just having fun. And they don't feel any social responsibility to
Good for
go help
them.
the world or something like that, you know? But it's just like, what happened to that, you
We're
know?
talking about teenagers here?
No, people my age, and they're just having fun, and it's the thing we talk about at parties is, wow, you're retired now, you can just fool around and do nothing, and it's just amazing to me that
Lori, you seem to
there
have experience in this.
doesn't seem. Well, I'm only because I'm only running a nonprofit, so that's what I do in my retirement, but you know.
What
when I
about
was thinking
maybe
about
Anything. How do you
mentorship?
get them? How do you guilt them back into working and serving their community? Is
What
I'm
if there
thinking.
was like a mentorship, something or other? This, like, in the moment thinking, there's got to be, and I think this would be so important for mental health and so many other things, but there is such a disconnect in a different way that the brains of current retirees function versus the brains of kids in high school, college, and the early part of their professional career. I think that would be an interesting experiment for sure.
It would. How would it address?
If perhaps someone maybe that is not sure, like they don't think that they want to go into a 4-year college, they don't have a goal within the CTE program, maybe they're working at Flatbread and they're just trying to figure out their life, they could be partnered with a mentor.
But all of those things do, and I'm not trying to.
Yeah, I know.
But all of those things do require coordination and somebody overseeing a program like that.
But that might be a good idea to add to Big Brothers Big Sisters. You know, have the people.
Right, there's an organization that's already doing it.
You know, when I think of addressing the workforce piece, it overlaps with addressing the childcare piece.
Right, and I
because-
have an idea for a childcare piece.
All right, shoot.
Throw it out there.
So subsidize businesses to provide on-site childcare, because you don't have to be licensed if the parents
That's
are
a
there
big ticket item, though.
on location. Well, maybe not. I mean, childcare doesn't make money, but it's not out to make money. It's for the businesses to retain their staff. That's really the goal. You don't need to make money at it. You just need to keep.
No,
your
I'm just
staff.
thinking about the amount of money it would take to
Oh.
provide this subsidy.
No, we did a learning center in the middle of COVID, and so their parents could drop their kids over, and we would get them online and do the work with them, and then had fun things to do before and after school, and it really wasn't that expensive. And it was a big incentive. We recruited nurses because we had that to offer.
You know who's doing this, Karen? Or Harmony Homes. They built
Oh, they're the
childcare.
best.
Yep.
And housing.
and
John and
housing.
Maggie.
Yeah.
Critical
And-
issues.
But, you know, selfishly, because they're thinking about
Right,
their own
they need their own
employees.
employees, right?
Right, and the turnover rates, I mean, it's $43,000 when your nurse leaves.
So
To
how,
hire a new one.
We've got a time crunch.
Yeah, there you go.
is there anyone for the public comment?
Let me exit this. Abby, if I exit this, it will save, right?
Yes, you are all
Don't
saved.
laugh at me.
Not laughing at you.
I don't know how to do Google.
It's okay. You did great.
Okay, let's find out. Go
Somebody?
back. There's no one on Zoom looking to
No?
give public comment.
Okay, so
Do we need?
knowing we have one more meeting, how do we,
I would say you have one more meeting on the books. This group could decide. in either-
yeah, before the not recommendations,
5th,
but
the
the
meeting.
update.
Can we make the next meeting a longer one?
Longer, yes. That's easier than, I think, trying to get
agree.
another meeting.
1 hour is not enough.
So by longer, do we mean a half hour longer?
1 hour long. I would
I'd say an
early.
hour, and if we get out a half hour early,
Okay,
great.
so
November 29th?
so we're looking at the 29th from 12 to 2?
Yes, I will move my 1:30 kiddo.
Yes,
Okay.
affirmative.
Eat lunch first.
Can I just share something, folks?
Well, we need to
At the
finish the
voting
meeting
booth,
first, though.
Did you notice how many young people were voting? I work at the polls all day, and there were the highest number of young folks voting that I've seen.
All right, we haven't adjourned the
Yeah,
meeting, though.
okay.
We have to.
No, just
Adjourn.
saying
Motion
it was
to
saying-
adjourn.
It appeared
Okay.
that young people talking to young, these folks talking to high school kids about what's important, what's the important issues.
Oh, sorry, second.
Yeah.
Portsmouth, actually,
There's so
there's
many-
Portsmouth and another community that has the highest young age voters.
Okay, so we had a motion to
Yeah,
adjourn
and I got
by
Abby
Lori.
Second.
Abby
Second by
seconded
Abby.
already.
All in favor of adjourning?
Aye.
Aye. Thank you, everybody.
Yeah.